Hey, Dr. Joe Niamtu here, working from the home office tonight, burning the midnight oil, trying to get another video going. So, otoplasty, or the correction of protruding ears, is one of my favorite procedures. And we do this a lot on children. We like to do it before they start school because children, unfortunately, get a lot of teasing and peer ridicule that can affect them for the rest of their life. But we also do it on adults, and there are people that just didn't have it done in childhood for various reasons. Maybe their parents couldn't afford it, or they just never got around to it. And so we're going to show you kind of what I call the unveiling, where we're seeing the patient the day after surgery and taking off his bandages and let him look in the mirror. Now, I got to tell you, some people look in the mirror and it brings tears to their eyes. This guy's about the least emotional person you can have, but he's really a great guy, and he's so happy with his results. So stick around. We're going to show you what we do. I'm Dr. Joe Niamtu, LoveThatFace.com.
Hey, I'm Dr. Joe Niamtu, LoveThatFace.com. One of my favorite procedures is doing otoplasty. People with protruding ears that had them all their life and setting them back. And so my patient today came here from Florida, and we did his surgery yesterday morning, so we're 24 hours out. And we've already taken down this and cleaned his ears up a little bit and removed some dressing, but he hasn't seen them yet. And I think it's always interesting to see patients' reactions. So we'll be back in a second. Okay, buddy, so we're gonna get this dressing off, and then we'll ask you some questions about lean your head forward a little bit for me there. Thank you. There we go. Now remember, since you've had the dressing on all night, your ears are going to be a little pasted back to the side of your head a little bit more than normal. But take a peek. Tell me if you see a difference there.
Wow, that's a huge difference.
Good. You like that?
Oh yeah, big time.
I think that's going to be a home run for you, buddy. And you're such a great guy. I'm so happy that it's going to turn out so well. Okay. Now remember, they will come out here just a little bit more, but I have them just where we wanted it, exact measurements. I think it looks perfect, and I'm really happy to see that. So you can put your mirror down a second and tell me about last night. You can look into tell them about last night.
Last night was very good, actually, and I had no pain, just pressure, and I had a good night's sleep.
Well, that's amazing. You're an amazing guy, and it was my honor to be your surgeon. We're going to come back and take a look at each ear now and show everybody what it looks like at 24 hours.
All right.
So as you can see in the before pictures, his ears were protruding, and he did not have this antihelical fold. So we have reconstructed a nice curved antihelical fold, and we took out the extra cartilage he had in the back, and were able to set the ear back in a normal position. So this blue stuff you see here is from our marking pens, from our surgical markings, and he has a little bruising here. And we attach this little cotton ball here that's going to stay in there for about 5 days. That just keeps everything positioned and prevents any hematoma. We'll go look at the other ear. So again, here are our surgical markings. We wanted this about 12 millimeters from his temple, and we wanted this from the mastoid area to the back of the ear, about 11 millimeters, and it's just lined up perfect. I think it looks really natural. His lobe is in natural position. We've created the antihelical fold. We've reduced the excess cartilage, and that's going to be really nice. Generally, your top of your ear is about a little finger's width, about a centimeter from the side of your head. So he's swollen, but that's just going to be perfect. I'm really happy with this result. So what we've done, we've cleaned everything up. We've replaced the Xeroform gauze and put a little cotton in each side, put a piece of gauze on each side, and then this is just a little stretch ace bandage, and we're going to leave this on probably, I mean, he can take it on and off, and he can take it off when he wants to eat or shower or whatever, but it's more of a reminder just so patients don't pull on their ears, or when they sleep they don't turn over. Technically, we probably don't need any bandage because we have that little cotton ball bolster sewn in there, but it's a nice reminder. So we'll see him again tomorrow, take everything off, and then he'll just wear this band. You know, in a perfect world, or for little children, we have them wear it 1 week, 24/7, and then the next week just at night. For adults, who aren't going to fiddle with their ears, they just wear it for a couple days. Time flies when you're having fun. Here we are 6 days after our otoplasty. So how's it been?
Been pretty good.
All right. How is the pain level?
No pain.
All right.
Just a slight pressure, but it's good.
All right. You think you're going to like the result?
Oh, I love him already.
All right. That's great. So everything is looking great. He's still swollen and a little thick, and that's going to go down. And when you do ears at first, because of the dressings, they're pushed back, but they're going to come out naturally. And I'm really pleased with this case. It's exactly where I wanted it, and I think it's exactly where he wanted it. Now, if you remember, we had little cotton balls in there, and we're going to show you, these are bolsters, and what these do is they hold everything together. So blood doesn't get under the delicate ear tissue, which would be hematoma, and they also stabilize this. So we leave him in about a week. So we're taking his out at 6 days. But so we suture this in, and I've already cut the sutures, and this just pulls out of there. And what this does is it holds everything back, and it pushes down on this area, so we have the nice uniform bowl, and that just looks beautiful. What can happen if you don't do that? Blood can get under there, and you could get like a cauliflower ear type deformity. That looks great, and if you remember from the pre-op video, he did not have this little antihelical fold here. So he has a fold, he has a nice conical bowl, his ears are a normal distance away from his head. They will relax a little bit more. I can't thank you enough coming all the way from Florida for me to do this, and it's been my honor to be your doctor.
No, thank you.